This is Coffee with Cade. Yay!
Yeah. Yay!
We're going to be having a conversation, not submitting a presentation. So
Right.
please feel free to send in your questions. If you submit them on Instagram, I will not be able to see them. But if you submit them on Facebook at Cade Foundation, the Cade Foundation Facebook page, which is facebook.com/Cade Foundation, I'll be able to share them with Dr. Chantel Cross, who is, again, a reproductive endocrinologist at Johns Hopkins. And we are really honored to have her here today. So once again, thank you and welcome, Dr. Cross.
Thank you for having me. I appreciate it.
Yay. So let's just jump right in and get started. We're talking about fibroids, which affect many, many women and are a major cause of infertility. So can you first talk a little bit about, before we get started, Dr. Cross knows that this is Coffee with Cade, so we all have beverages. And hopefully at the end, she will. Okay, so I'll have to show you what's in my cup at the end of the conversation.
Okay, yeah, I'm like, I threw in my coffee already for the morning. I started at 7 a.m., so my coffee has been and gone.
Okay, well, she just got the party started a little earlier.
Yes.
Moving on. So Chantel, what is a fibroid?
So fibroids are benign, meaning non-cancerous, tumors, meaning they're growths of tissue, specifically of muscle within the uterus.
Okay. So it's a benign, non-cancerous tumor that is in the uterus.
In the wall of the uterus. And these fibroids can grow on the top of the uterus, they can grow within the muscle of the uterus, or they can actually grow inside the womb where the baby grows. And the fibroids that grow inside the womb are the ones that are most problematic for patients who are trying to become pregnant.
So I know many people who have fibroids have been told it's going to be hard for you to get pregnant, regardless to where the fibroid is located. Is it often recommended that before people have fertility treatment that they actually get the fibroids taken out?
You know what? I don't say that routinely. So the thing about fibroids is that they're so common. A lot of women have fibroids. Up to 3/4 of women, 75% of women will have fibroids at some point throughout their lifetime. And a lot of the time, it's completely asymptomatic. You may not even know you have fibroids. So it's really the women that have this huge fibroid burden, that those fibroids are somehow distorting the endometrial or the cavity of the uterus or the womb in such a way that can prevent fertility or can be dangerous for carrying a pregnancy. So not every fibroid is the same. They should not all be treated the same. Some don't require any treatment.
That's interesting. So, okay. So it's important that before you kind of start down one road that you talk to someone who specializes in the treatment of infertility if you're thinking about having surgery to have your fibroids removed, because it may not even be necessary. So that's good information. Well, so what causes fibroids?
You know, I wish we knew. I wish we knew what causes fibroids. We know that there are some genetic mutations that have been found in laboratory studies that are associated with fibroid growth, but we really don't have a reason behind all fibroids. So they're clonal, meaning they come from one cell that kind of goes awry, and that one cell keeps replicating and becoming this mass of tissue. We know that there are certain ethnic groups that fibroids are more common in, such as African American women have a higher fibroid disease burden. We know that there are environmental and lifestyle factors that put you at risk for fibroids, but we really don't have a reason as to why fibroids occur.
So what are some of the environmental and lifestyle factors that affect fibroids or affect your likelihood to develop them?
So what's been studied is that increased levels of estrogen can increase your fibroid burden, okay? As well as women with high cholesterol, surprisingly, and high blood pressure have a higher risk of fibroids. Things that reduce your risk, or having children actually reduce your risk of fibroids, surprisingly. So the more children you have, the less risk of fibroids you have. One of the big nutritional factors that is associated with fibroid growth, and some research that I've done, is particularly on vitamin D and fibroids. So you got to get some sun, you got to have vitamin D. So we've shown in lab studies that vitamin D can reduce fibroid cell growth and fibroid cell division. So in women who are vitamin D deficient, have larger fibroids and more painful fibroids. So it's really important that we have, vitamin D levels that are adequate.
So does that mean that people who come from places where it's really sunny are less likely to have fibroids than people who come from places where it's less sunny?
Not exactly, right? Because we also know that women of African descent also have very large and painful fibroids, and that continent is obviously on the equator. They get tons of sun exposure. But women who are near the equator also have higher levels of melanin, and melanin actually prevents vitamin D absorption. Okay, and so it's a balance of the melanin in your skin and the vitamin D that you're able to absorb. And so the majority of the population is vitamin D insufficient. So it's a matter of getting your levels checked and making sure that they're appropriate. I will say that although vitamin D deficiency is associated with fibroid disease, there has not been any randomized clinical trials showing that vitamin D treatment in patients will reduce their fibroid burden. Just all the work that has been done in the labs looking at fibroid cells in the labs.
Okay, well, this is very interesting. So for everybody who's watching, make sure you get outside and at least get some of that free vitamin D that comes when you get in the sunlight. But wear your SPF, right?
Yeah, oh yes, awesome.
So we kind of touched on this earlier, but can you talk a little bit about how fibroids affect fertility?
Yeah, so really they can affect it in a number of ways. So it really depends upon the location and the size of your fibroids. So fibroids that are greater than 3 centimeters in size are the ones that are most concerning for affecting your fertility. And fibroids that grow within the uterine cavity itself can really affect your ability to conceive as well as to carry a pregnancy to term. So fibroids that grow within the uterine cavity can prevent implantation of a pregnancy, as well as cause second trimester pregnancy losses if the baby tries to implant over the area of that fibroid. All right, that's not normal tissue, and the placenta doesn't adhere as well. So you're at increased risk for miscarriage. Additionally, fibroids that are growing near the fallopian tubes, all right, so they can distort the anatomy of the fallopian tubes and actually cause blockages of the tubes. So it really depends upon the location and the size to determine if that fibroid is one that can affect your fertility.
Okay, that's very interesting. And for people who have fibroids, who get pregnant, are there things that they can do to minimize the chance that they will have a problem associated with the fibroid?
Well, I really think it's important prior to becoming pregnant, if you know you have fibroids, to see your doctor, your OBGYN specifically, to make sure that the fibroids that you have aren't high-risk fibroids, okay? So getting an examination, they may start with just a pelvic ultrasound to assess the size and location of the fibroids, or they may do something a little bit more invasive called an MRI, which is where you're in the tube, and that can give you a really that's the best assessment of fibroid size and location. And that will really help you to understand if your fibroids are one that puts you at risk of infertility or at risk of pregnancy loss.
So pelvic ultrasound is the ultrasound where they insert a probe into your vagina just to look at all the organs inside the body.
Exactly.
The MRI is when your body, when you're put into kind of a tube and you're slid in.
Mm-hmm. Exactly. So I generally start with my patients with an ultrasound in the office. If I see a large number of fibroids or fibroids that appear to be close to the uterine cavity, I then will get an MRI so I can actually measure the distance and get a better idea if the fibroids are actually distorting the cavity. And also depends on if the patient has symptoms. If patients have no symptoms and their fibroids aren't near the cavity, I don't really do much about them. But if they're large or symptomatic, then they should be addressed before pregnancy. Fibroids can either grow in pregnancy or they can shrink in pregnancy.
Wow.
And it really depends on the pregnancy and on the person. So we've seen it happen both ways.
So what would make them shrink, or what are some of the characteristics of people who have shrinking fibroids?
You know what? Sometimes the fibroids, so the uterine blood vasculature increases during pregnancy, and depending upon the location, it may rob those fibroids of that blood flow, and those fibroids can undergo degeneration. Contrastingly, pregnancy is a high estrogen and progesterone state, and fibroids are fueled by estrogen and progesterone. So it really depends upon the location and what the blood supply is to those fibroids.
Wow. Okay, that's really great information. So we talked about risk factors for being susceptible, including people who have melanin in their skin. So women of African descent, Latinos. Are there any other groups that are at greater risk for developing fibroids?
Really, African American women take the cake, unfortunately, in this competition of fibroids. So African American women, not only do they have a higher fibroid burden, so they also have worse disease severity. So they have larger, more painful fibroids, heavier cycles related to those fibroids. And whereas when you compare it to Caucasian women, most Caucasian women will have a shrinkage of their fibroids after menopause, whereas African American women are actually likely to have fibroid growth even beyond menopause. So not only is it higher incidence, but it's bigger burden of fibroids.
Okay, all right. So being African American places you at great risk for developing fibroids, but they do occur in other groups of women. Not having enough vitamin D, having high cholesterol, having
blood pressure,
yeah. Having a lot of estrogen. And I know that estrogen can be connected with weight. So is it more common in women who are heavier, who have a higher BMI?
You know what? I'm not 100% sure about that fact. So I'd have to look into that to see if weight in and of itself is a risk factor. That's not popping to the top of my head as one of the risk factors. So I'd have to double check on that.
Okay, that's good. All right, so
a modest increase, a modest association. So it's not a strong association, but a modest association with obesity.
Yeah. Okay. Well, but that's still an association, even if it is slight. So, what are some of the symptoms? So how would a woman know that she has a fibroid if she has not been seen? She hasn't had a reason to go in and ask if she has a fibroid.
So the most common symptoms of fibroids are heavy and painful periods, okay? So that fibroid can cause increased amount of cramping during your menstrual cycles, and it also can cause very heavy periods where you're soaking through a pad an hour, using the super tampons and a pad and still having accidents, leaking through your clothes. That's not normal. I know some people think it's normal for them because that's all they know. That's not normal when it comes to looking at a group of women in their menstrual cycles. So heavy and painful periods are the most common symptom. Other symptoms are related to the location and the size. So as you can imagine, your uterus actually sits very close to your bladder, okay? So if you have a fibroid on top of your uterus, it could actually push into your bladder and can cause you to have urinary frequency. You're going to the bathroom all the time, or you can't tolerate having a full bladder for very long. Or maybe even you can't empty your bladder completely, okay, because that fibroid is blocking your bladder. Otherwise, if you look at the backside, your uterus is close to your rectum, okay, so you may have trouble having a bowel movement, or have loose stools, or always constipated because the bowel evacuation is not normal because it's affected by the fibroids. Women who have really enlarged uteruses, so the uterus goes all the way up to their rib cage, they can have shortness of breath, They can feel bloated. They can actually look pregnant because of how many fibroids that they have. They can have abdominal pain. And very rarely, it can actually, the fibroids can push on the tubes that connect your kidneys to your bladder and cause kidney disease. Okay. And those are in very severe cases when fibroids are left untreated for many years.
That's interesting. So just to recap, you could have pain, you could have what feels like a swollen belly, have pain with urination or with having a bowel movement. You could have a hard time emptying your bladder, so it feels like you have to go often. Or you could have constipation and diarrhea. What about pain with intercourse? Is that associated with fibroids?
Not really. That's more of a symptom associated with something called endometriosis, which is a different type of condition. Now, if you had a fibroid that was lower near your cervix, perhaps, you might have that pain, but generally pain with intercourse isn't something that would make me think of a fibroid directly.
Okay, okay. But some of these others, if you're watching and you've experienced some of these symptoms, go see your doctor. Don't be afraid to get help. And you know, fibroids fall squarely into the practice of a reproductive endocrinologist. Again, even if you're not trying to conceive, these are endocrinologists, and they can help with other endocrinology concerns. So, and there's
yeah, I see a lot of patients who will come to me for their fertility assessment before planning surgery for their fibroids, or who I will say, you know, before you do fertility treatments, you recommend having a fibroid surgery, and then send them to, you know, a minimally invasive fibroid specialist, or we talk about what's the best timing for dealing with your fibroids and also assessing your fertility, and if something is necessary before treatment.
And to have the fibroids removed, is it a big surgery? Is it something people would need to take, you know, 6 weeks off or a couple of months off? Is it the big kind of the cut down the belly, or what are the different treatments available?
Right. So there are medical treatments and there are surgical treatments, and there are radiologic treatments. Okay. The medical treatments for fibroids really aren't conducive to someone who's trying to get pregnant, because our first line therapy are things like birth control pills to suppress your menses. There's medical treatment, something called Lupron, which is an injectable medication that lowers your estrogen and progesterone levels and stops the fuel that the fibroids are growing on. But because it's lowering your hormone levels, it's preventing ovulation. So it's definitely not helpful for someone who's trying to get pregnant. Okay. There are radiologic treatments for fibroids. So there's MRI-focused ultrasound, high-frequency ultrasound, where they use high ultrasound frequency waves to actually disrupt the cellular growth within the fibroids. And there's also something called uterine artery embolization, where they block some of the blood vessels feeding the fibroids. Okay, or uterine fibroid embolization is another term for that. Those treatments really are not recommended for women who want to conceive afterwards, okay? Because those pregnancies will be at higher risk for issues with placental development, okay? The mainstay of treatment for women with symptomatic fibroids who wants to preserve their fertility is with myomectomy, which is removal of the individual fibroids from the uterus. That can be done in several ways. The preferred way is a minimally invasive approach, either with laparoscopic surgery, meaning with cameras and small incisions, or robotic surgery, which is another way to do laparoscopic surgery. And it really depends upon the size and the number and the location of the fibroids that determines what route of surgery you can have. Okay. There are some women who have such huge burden of fibroids that they're not candidates for a minimally invasive approach because there's just too much disease present. Okay. Those women would have to have the up and down incision, the laparotomy that would take the 6 to 12 weeks recovery. Okay. With the minimally invasive surgery, you may be admitted for a day, or you may go home the same day as your surgery. Most recovery takes about 2 weeks in terms of time off of work, 6 weeks in general to allow your uterus to completely heal. And we mostly recommend waiting 3 to 6 months before trying to conceive after the surgery.
Okay, so could be a lot. It could be very minimal, and you'd be able to go right back to work. But
Right.
either way, fibroids are something that you need to take seriously, and this is something that is treatable by medication and by surgery. And we've got a great physician right here, Dr. Chantel Cross. So if you're in Baltimore and you are concerned about fibroids, she's an expert. Please look out or seek her at Johns Hopkins, because she may be able to give you some support and some help to this condition. So fibroids are not, having fibroids, what I'm taking away from this conversation is having fibroids doesn't mean that you will not be a parent. Is that right?
It is a treatable condition. It is a treatable condition for the vast, vast majority of women.
Awesome. Well, Dr. Cross, thank you so much for coming on. This was great. I know that there is a lot of interest in this topic, and so I'm sure that you will have a fair number of people following up with you to get more information and to get more support. And again, if you have any questions for Dr. Cross, she is at Johns Hopkins Medical Institution, and you could look on their website, jhmi.edu or .org. Last but not least, we've got a couple of things going on at Cade. We've got Porks with Cade, which is going to be at the Hidden Hills Farm and Vineyard. We are going to be serving gourmet pizza from a Frederick-based pizza company. We'll have cupcakes. We'll have tastings of some of the fantastic wine that is produced at the vineyard, and we'll have live music. So I hope that you'll join us on August the 15th from 2 to 6 at the Hidden Hills Farm and Vineyard. And we are also getting ready for our first national conference, which is going to be, yay, at Georgetown University. On November the 2nd and 3rd, we'll have an advocacy training opportunity on November 2nd, and then we'll have a morning conference, and we have sessions for doctors that focus on genetic screening. We have 2 patient-focused sessions, one that's for patients with PCOS and another for patients just with all other types of infertility. And then we have a session that's hosted by the ASRM that's focused on providing support for nonprofits and charities that are doing the hard work of supporting families with infertility. So we hope that you'll come out and join us. And you can get more info about all of these things on our website, cadefoundation.org, as well as on all social media platforms. So again, shameless plug. Today, I'm going to pull out my non-Coffee with Cade mug because that one needs to be washed. This is a Starbucks mug. And I had a cup of Earl Grey. So that's what I'm sipping on this morning. So thank you, Dr. Cross.
Thank you for having me. It's been a pleasure.
Yay.